Okay, hi everybody, Dr. Baumholtz from Baumholtz Plastic Surgery, 210-920-2390. And today we're going to talk about rejuvenating the back of the hand. And I've got two great models in different age categories to show what this particular product can do. The first candidate is 77 and feels that the back of her hands sort of give away her age more than anything else. And so the hands are one of the last places that we can hide or show our age. There's a product, and I'm going to show you. This is the branded product Radiesse. And Radiesse has a lot of great uses, and one of them is for back of hand rejuvenation, and I'm going to show you our technique for doing that. The product comes, it's about 1.5 cc's, and to that we mix some plain lidocaine, and I'm going to show you how that works. And here I've already started the mixing process, but basically I put my lidocaine and I've got my branded product, and I mix back and forth until it gets to a consistency that I'm happy with. Once I'm ready for that, we're then going to transition to the injection, and I'm going to show you a live injection here in just a moment. Now, some words about the injection. I'm going to have the cameras turned to the back of the hand here. And this candidate, as I said, she's 77 years old, and in a few minutes we're going to look at a slightly younger candidate, but the goals are the same. But we can see that the intrametacarpal spaces, that is the spaces between the tendons, sort of hollow out over time, and we'd like to restore some of that youthful volume. We're going to take some alcohol. Now, I've already had her wash her hands for a number of minutes. We've removed all the jewelry, and we're going to cleanse the skin just with some rubbing alcohol. Because there is lidocaine now mixed in the product, I don't do any additional blocks, although I know there are some people out there that do. It's not a particularly painful process, and we're going to begin here in just a moment with the syringes that we've already got made up. Now, in someone in this age category, it's likely that probably more than one syringe per hand would be necessary, but we're going to start with just one per hand, and then we bring it back in a week or so and we see if you're happy. If you're happy, we're done. If not, we can add another. Typically, with this much loss in between the intermetacarpal spaces, you might expect 2 or 3 syringes per hand, per side. All right, so this is the product and this is how it begins. And all I'm going to do is I'm going to tent the skin up here, and I'm going to put just a little wheel of the medicine, roughly 0.4 cc. So I'm going to get into the skin. I'm going to make sure I'm not in a tendon or a vein, and then I'm going to deploy or deposit some of the medicine. And it's a little tough to go through these tiny, tiny little needles, and I'm going to put a little bit there. And I'm going to move over to this side. Here we are. I'm going to lift the skin up. So far, you doing okay? Am I hurting it? And I'm going to make sure that I'm not in a vein or a tendon, and I'm going to move it around, and I'm going to put a little more. All right. And then I'm going to move over here, and I'm going to work at the distal aspect of it. And I'm going to, because that's where we've got some laxity. And again, I'm going to make sure I'm not in a tendon or in a space, and I'm going to fill this area up. Okay. And then I'm going to move over here to the last. This is the first intermetacarpal space, and I'm going to lift up. And again, I'm going to make sure I'm not in a vein or a tendon, and I'm going to fill the rest into here. The next thing we're going to do is we're going to take a little Vaseline or a little ointment. And so I'm going to withdraw this out for just a moment. And I'm going to set that down. And we have some ointment. Well, I'm going to use just some gentle lubrication. And I'm going to spread this over. And I'm going to massage this into the hand, working from distal to proximal. And we can already see some changes happening in that space. Now, in terms of the injection, that's it. What I would do next is I tell the patient, I'm going to take this towel, and you're going to put your hand here, and then I'm going to have them just sit on it. So I'm going to have you just scoot that onto your backside, and we're done with that side. Okay, so stay tuned. We're going to do the younger patient here in just a few minutes. And again, Baumholtz Plastic Surgery, 210-920-2390. And this was Radiesse for dorsal hand rejuvenation. Thanks very much.